That stuck, blocked feeling, like your body wants to go but nothing's actually moving, isn't random and it isn't rare. There's a real medical reason behind it, and today we're breaking down the 5 most common causes, plus what actually helps when it happens. What you're dealing with has a name: fecal impaction. That's when stool becomes hard and compacted enough that it physically gets stuck in the rectum and can't pass on its own, even with straining. It's more common than people think, especially among older adults, people with limited mobility, and anyone with a history of chronic constipation. The symptoms usually go beyond just not going. There's often a feeling of pressure or fullness that doesn't go away, straining that doesn't lead anywhere, bloating, lower belly discomfort, and sometimes, confusingly, a small amount of liquid stool that leaks around the blockage. That last one throws people off because it can look like diarrhea, when the real problem is a blockage sitting right behind it. So why does this happen in the first place? There are 5 main reasons, and figuring out which one applies to you is what actually determines what will help. The first, and most common, comes down to diet and hydration. When your body isn't getting enough fiber or enough fluids, stool moves through the colon much more slowly than it should. And the longer stool sits in the colon, the more water gets pulled out of it. That's the colon's job, reabsorbing water. But when transit time is too slow, it pulls out too much water for too long, leaving stool hard, dry, and difficult to pass. This creates a frustrating cycle. Hard stool is more painful to pass, so there's a natural tendency to avoid the urge, which gives the colon even more time to pull out water, making the next attempt even harder. Over time, this cycle is enough on its own to lead to a stool that simply won't move, the very definition of an impaction. But diet isn't always the root issue. Sometimes the problem isn't what you're eating. It's what happens when the urge actually shows up. This is the second major cause: habitually ignoring or delaying the urge to go. It sounds minor, but it has a real physical effect over time. Every time you feel the urge and hold it in, because you're at work, because the bathroom isn't convenient, because it's uncomfortable, or simply out of habit, the rectum stretches slightly to accommodate the stool that's waiting. If this happens often enough, the nerves in the rectal wall become less sensitive to that stretch. That means it takes more and more stool buildup before your body even registers the urge to go. Eventually, the signal becomes so weak that a large amount of stool can sit there, hardening the entire time before you feel anything at all. This pattern is especially common in children who avoid using unfamiliar bathrooms, in people with demanding schedules who repeatedly hold it, and in older adults whose sensation naturally becomes less sharp with age. The unsettling part is that this cause can exist even in someone who eats well and drinks enough water, because the issue isn't the stool itself, it's the body's ability to recognize it's there. Even with a perfect diet and normal bathroom habits, there's a third cause that catches a lot of people off guard: medications. Several very common drugs slow down the digestive system as a side effect, and most people never connect the dots. Opioid pain medications are one of the biggest culprits. They don't just relieve pain, they also slow down the muscle contractions that move stool through the intestines, which is why constipation is almost universal among people taking them regularly. Iron supplements are another common one. They're notoriously hard on the gut and frequently lead to harder, slower moving stool. Certain antidepressants and antihistamines have what's called an anticholinergic effect, which relaxes the muscles of the digestive tract more than they should be relaxed, slowing everything down. Even something as ordinary as an antacid containing calcium or aluminum can contribute if it's used often enough. None of this means these medications should be stopped without talking to a doctor. Many of them are necessary. But it does mean that if constipation showed up around the same time a new medication started, that timing is worth paying attention to. Speaking of hidden causes, here's something most people never think to question: a factor that has nothing to do with diet, habits, or medication, and it's been quietly working against your digestion every single day without you realizing it. There's an unusual, ancient food pulled from the ocean that's been used for thousands of years in places where digestive issues are surprisingly rare, and it works in a completely different way than fiber or probiotics ever could. If you want to understand exactly how this works, point your phone camera at the QR code on the screen right now to see the full explanation. There's also a link pinned in the comments below. The fourth reason is less well known, but it's a big one. A coordination problem between the brain and the muscles involved in having a bowel movement. This is sometimes called pelvic floor dysfunction or dyssynergic defecation. Normally, when you bear down to pass stool, the muscles of the pelvic floor and the anal sphincter are supposed to relax and open the way. But in some people, those muscles do the opposite. They tighten instead of relaxing, even while the person is actively straining. It's an involuntary, often unconscious miscommunication between the brain and the muscles down there. The result is that stool can be sitting right at the exit, ready to go, and the body is essentially fighting itself, straining hard while simultaneously clamping the door shut. This is one of the reasons some people say fiber and laxatives don't work for them, because the problem was never about stool being too hard or too slow. It was a mechanical, muscular miscoordination the whole time, and no amount of added fiber fixes a coordination problem. The fifth reason is broader, but important to know about: an underlying medical condition affecting the nerves, muscles, or structure of the colon and rectum. Conditions like hypothyroidism can slow down the entire digestive system because thyroid hormone directly affects how fast muscles contract throughout the body, including in the gut. Neurological conditions such as Parkinson's disease, multiple sclerosis, or spinal cord injuries can interfere with the nerve signals that coordinate bowel movements. Structural issues matter too, something like a rectocele, where the rectal wall bulges into the vaginal wall, can create a pocket where stool gets trapped instead of moving forward normally. In older adults, reduced mobility itself is a major contributing factor, since physical movement helps stimulate normal colon activity, and long periods of sitting or lying down slow that stimulation significantly. This is the category where impaction tends to become recurrent rather than a one-time event, because the underlying cause doesn't go away unless it's specifically identified and treated. So those are the 5 reasons: diet and hydration, ignoring the urge, medications, muscle miscoordination, and underlying medical conditions. Knowing which one applies changes everything about what actually helps, because a fix that works for one cause can do nothing for another. When stool is already stuck and needs to move now, the approach depends on how severe it is. For mild to moderate impaction, an osmotic laxative, one that draws water into the colon to soften stool, rather than a stimulant that forces contractions, is generally the safer first step, because it works with the body's natural process instead of forcing muscles that may already be strained. Glycerin or stool softener suppositories can help by softening stool directly at the site of the blockage, right where it's needed most. In more significant cases, an enema may be used to introduce fluid directly into the rectum, which helps break up and soften the impacted stool so it can pass. What should generally be avoided is repeatedly straining hard against a blockage that isn't moving, since this can increase pressure in the rectal area and, in rare cases, contribute to complications like hemorrhoids or even a rectal prolapse, where the tissue itself gets pushed outward from repeated straining. Instead, hydration becomes especially important during this window. Not just drinking more water, but drinking enough to actually support whatever softening method is being used, since a laxative or suppository has nothing to work with if the body is dehydrated. Warm fluids, in particular, can help encourage the natural muscle contractions of the digestive tract. Gentle movement matters too. Something as simple as walking can stimulate the colon, because physical activity naturally encourages the wave-like muscle contractions, called peristalsis, that move stool along. Even light abdominal massage, done in a clockwise direction following the natural path of the colon, is sometimes used to help encourage movement when things have slowed down significantly. That said, there's a point where home methods aren't enough, and recognizing that point matters just as much as knowing the home remedies themselves. If there's been no bowel movement for several days despite trying safe home measures, if there's severe or worsening abdominal pain, if there's vomiting, fever, visible blood, or the abdomen appears noticeably swollen or distended, these are signs the impaction may be more significant than it appears, or that a complication is developing. At that point, It's not a situation to keep managing alone. A healthcare provider can perform what's called manual disimpaction, where the hardened stool is carefully and directly removed. It sounds unpleasant, but it's a quick, safe, and often immediately relieving procedure, and it's a completely normal part of medical care. Nothing to feel embarrassed about, since it's one of the more common issues providers deal with, especially in emergency and urgent care settings. Now here's the part that actually matters most long-term. Which of the 5 causes applies to you determines what kind of fix will actually stick. If the root issue is diet and hydration, the fix isn't a one-time laxative. It's a gradual shift toward more fiber-rich foods and consistent water intake throughout the day, not just occasionally. Fiber should generally be increased slowly, since a sudden jump can cause bloating and discomfort. And it works best when paired with enough fluid, since fiber without water can actually make stool bulkier without making it easier to pass. If the issue is a habit of ignoring the urge, the fix is behavioral, responding to the body's signal as soon as it shows up, rather than waiting for a more convenient time. Over time, consistently responding to that urge helps restore the sensitivity that gets dulled over time, since the nerves in the rectal wall respond well to consistent, regular signaling rather than repeated suppression. It also helps to build a predictable routine, like allowing time in the morning when the body's natural urge tends to be strongest, rather than rushing through a schedule that leaves no room for it. If medication is the underlying cause, the fix isn't necessarily stopping the medication, since many of these drugs are essential for managing pain, mood, or other health conditions, but rather talking with a healthcare provider about whether a preventive approach makes sense. In many cases, providers will recommend starting a stool softener or fiber supplement alongside a medication known to cause constipation, rather than waiting for a problem to develop. This kind of proactive approach is especially common with long-term opioid use, where constipation is expected almost every time, so prevention becomes part of the treatment plan from the start. If the cause is a muscle coordination issue, like the pelvic floor not relaxing properly during a bowel movement, fiber and hydration alone usually won't solve it, because the problem isn't about stool consistency at all. This is where a specific kind of physical therapy called biofeedback training becomes useful. It involves working with a specialist to help retrain the muscles and nerves involved in defecation, essentially teaching the body to coordinate properly again. It sounds technical, but it's a well-established, non-invasive approach, and for people whose impaction keeps coming back despite doing everything else right, it's often the missing piece that finally makes a difference. And if the cause is an underlying medical condition, whether it's a thyroid imbalance, a neurological condition, or a structural issue like a rectocele, then addressing the impaction itself is only a temporary fix unless the underlying condition is also being managed. This is why recurring impaction, especially in someone who otherwise eats well, stays hydrated, and doesn't ignore the urge to go, is a signal worth taking seriously. It's not something to keep treating over and over at home. It's a pattern that deserves a proper evaluation to identify what's driving it. There's one more piece worth understanding because it ties all 5 causes together. Prevention works best when it's consistent, not reactive. Waiting until stool is already stuck and then scrambling for a fix is far harder on the body than maintaining steady habits that prevent it from happening in the first place. That means regular meals with enough fiber spread throughout the day, rather than one large amount at once, water intake that's consistent rather than occasional, movement built into the day even if it's just walking, and, perhaps most importantly, treating the urge to go as a priority rather than an inconvenience whenever it shows up. It's also worth mentioning that occasional constipation is normal and usually resolves on its own. The goal here isn't to create anxiety around every missed day, but to recognize when a pattern is forming, repeated straining, a sense of incomplete emptying, or reliance on laxatives that seem to work less and less over time. Those are the signs that one of these 5 underlying causes may be at play, and that it's worth identifying rather than just managing the symptom over and over again. Fecal impaction can feel like an isolated, uncomfortable event, but it's rarely random. It's almost always the endpoint of one of these 5 patterns building up over time, sometimes for weeks, sometimes for much longer. And that's actually useful information because it means the solution isn't guesswork. Once the underlying cause is identified, whether it's something as straightforward as hydration or as specific as a muscle coordination issue, the path forward becomes much clearer and recurring episodes become far less likely. The body is generally very good at signaling when something isn't working the way it should. A single uncomfortable day rarely means much on its own, but a repeating pattern is the body's way of pointing directly at one of these 5 causes. Paying attention to that pattern, rather than dismissing it, is often the difference between dealing with this once and dealing with it again and again.